Dear students, welcome back. In the previous session, we have discussed about articulations of the spine or the vertebral column. And we have discussed about there are two kinds of joints. One is intervertebral joints, another one is the zygapophyseal joints. We have discussed all these two joints in detail, and what are the types of motions occurs in these two types of joints also we have discussed. Especially in the case of intervertebral joints, we find three translations and three rotations along and around three axes we have seen, and also the compound effects of these small amounts of mobile segments of translation and rotation at a series of vertebrae produce a large motion for a column as a whole. Okay, I have mentioned in the previous discussion that the motions available to the column as a whole, if you consider the entire vertebral column as a whole as that of joint, it is having 3 degrees of freedom. So the entire vertebral column is having 3 degrees of freedom permitting flexion. For example, this is in the AP view. So this one is flexion, extension. Okay, and also flexion, extension which are taking place in the sagittal plane, and another one is the lateral flexion. So like this lateral flexion, and another one is the rotation of the intervertebral column. So these are the movements of the spine are present as a whole. Okay, if you see how these movements are going to take place, so this one is the entire trunk movements, so which includes all the cervical, thoracic, and also the lumbosacral. So the entire thing. So this one is the flexion of the trunk, and this one is the extension of the trunk. This is the lateral flexion, and this one is the rotation. Okay, here you can see this one is the right side rotation. Okay, so if you see the planes, this one is the flexion is taking place, flexion and extension is taking place in the sagittal plane, in the coronal axis, sagittal plane and coronal axis. So this one is coronal plane, lateral flexion is taking place in the coronal plane and in the sagittal axis. If you see the rotation, it is taking place in the transverse plane. So rotation always taking place in the transverse plane in the vertical axis. The vertical axis, this is the transverse plane, and this one is vertical axis, may be coronal or sagittal axis, both include as vertical axis. So these are all the movements which are taking place in the vertebral column. So if you see all these things in the vertebral column, the movements are not taking place as pure flexion, pure extension, lateral flexion, rotation. Only pure flexion is not taking place and pure extension is not taking place. Lateral flexion is not purely, only lateral flexion without any motions in the other things are not happening like that. So here such a kind of pure motions are not taking place in the vertebral column. So the motions in the vertebral column often are coupled motions. So very, very important thing. If you understand this coupled motions, and in future when you are doing some manipulation techniques, okay, or the spine, it is very useful. So Please focus on these coupled motions. Okay, what do you mean by coupling here? Okay, coupling is defined as the consistent association of one motion, about an axis with another motion. So one motion on one axis. So this is the main motion, and it is associated with another motion, in or around a different axis. Such kind of motions are called as coupling motion. Okay, coupling is defined as the consistent association of one motion in one axis with another motion around a different axis, then it is called as coupling. Okay, so we are going to see this coupling patterns. Okay, I am going to give some examples. So what is coupling again? So coupling is defined as the consisting association of one motion, okay, one motion in one axis. So this becomes the main motion. Okay, and it is associated with another motion, around different axis. So this is called as coupling. The motion which is being produced by an external load. So that means what is the main motion which causes, so for example the person wants to flex, to lift something. So this becomes the main motion. Okay, the motion being produced by an external load is termed as main motion. And all accompanying motions, so some other motions also taking place along with flexion. Okay, so such motions are called as coupled motions. The another motions are coupled motions. Okay, for example, when the lumbar spine is axially rotated. So here you can see when the lumbar spine is axially rotated. So it is rotated towards the right. Okay, so what happens means axially rotated, it bends in the frontal and sagittal planes. So what do you mean by it bends in frontal and sagittal planes means? So what do you mean by frontal plane bending? Frontal plane bending means, so this becomes the frontal plane, isn't it? So that means it causes lateral flexion. So frontal plane bending means lateral flexion. If you see the sagittal plane bending, then it is called as flexion, forward flexion. So when the lumbar spine is axially rotated, it bends in both sagittal plane as well as in the coronal plane. Okay, so actual motion is taking place in which axis? That means transverse plane and in vertical axis, isn't it? What happened to the another motion? So another motions are, one is side flexion, okay, or lateral flexion. What is happening here? So lateral flexion is taking place in the coronal plane or in the sagittal axis. So here the axis is going to differ. Okay, if you see in the forward flexion also, here it is getting what plane? Sagittal plane and coronal axis. So what happened? The another motions are taking place in the different axis. Okay, so such kind of motions are associated with the main motion are called as coupling patterns. So this one you have to keep it in mind. I have given this example. If you want to manipulate the lumbar spine, you have to keep it in mind about this kind of thing. Okay, if you want to rotate the lumbar spine on the right side, you have to consider not only the rotation, okay, in the transverse plane, you have to keep it in mind which is taking place, the other motions, that is side flexion or the lateral flexion and the forward flexion. Okay, and I am also giving another example of coupled motion. You just take the coupled motion of lateral flexion. So what will be the other motions? Just simply opposite to the earlier thing. What is going to happen? It is going to happen axial rotation as well as the forward flexion. Okay, so this is the another example. Okay, and this coupling patterns as well as the types and the amounts of motions that are available differ from region to region and are dependent on the spinal posture as well as in the curves. I have given the examples of when the spine is maintaining the normal curve or normal posture. Okay, and also such kind of motions also depends on orientation of the articulating facets. Very important. Because of the orientation of articulating facets, so here what is going to happen? The range of motions, the amounts of motions are going to vary in the cervical, thoracic as well as in the lumbar regions. Okay, and also the fluidity, elasticity and the thickness of the intervertebral discs are also plays an important role to show such a kind of movements. And also very important thing, that one is the extensibility of the muscles, ligaments and joint capsules. So all these are also affect the coupling patterns of the motion which are available from region to region. Okay, so I'm going to explain one coupled motion pattern, that is left lateral flexion in all the regions. Now we will see here. Yes, I have taken this motion, that is lateral flexion on the left side. So I am going to consider the spinal segments from C2 to C5. So this is the anterior view, this one is the lateral view and the posterior view. So I am going to take from C2 to C5. Okay, that is called C2 to C5 means mid cervical region. Okay, and also I am going to consider the lower cervical region C5 to T1, C5 to T1, C5 to T1. Okay, and the upper thoracic region T1 to T4, T1, T2, T3, T4 up to here. So I have considered these spinal segments. So what happens? So what is the motion I have taken? What is the spinal motion I have taken? So lateral flexion towards the left side. So this one is anterior view, this becomes left. If you see in the posterior view, this becomes the left side. Okay, what is going to happen here? So what is the coupling motion? So the spinal motion, we know that is left lateral flexion. Okay, left lateral flexion. So this is the spinal motion. What is happening? What are the coupling motions here? Okay, So rotation of the vertebrae towards the left. That means the spinous processes are moving towards the right side. Spinous process will move towards the, and the body will rotate in this way. And also what is happening here means forward flexion is also going to takes place. What are the coupling patterns we have seen here? One is the rotation, that is the axial rotation, okay, towards the left, and the forward flexion. So how can you identify that the body is rotating towards the left side? Because the spinous processes are rotating towards the right side. Okay, so this is the thing happening up to this level. So I have taken mid cervical, that is C2 to C5, lower cervical, that is C5 to T1, and upper thoracic T1 to T4. Okay, now I am going to take another spinal segments. One is mid thoracic, that is T4 to T8. I have taken T4 to T8. Okay, and also and lower thoracic from T8 to L1 I am going to take. So I have considered from T4 mid thoracic and lower thoracic. What is going to happen here? What is the spinal movement? So again left lateral flexion. So what is happening here in the in these segments here? So here it is very interesting, because the orientation of the facets in the mid thoracic is different from the lower thoracic. So for that, the rotation of the vertebrae is maybe left or right, varies with the individual. Okay, so you just do the left lateral flexion and feel that, so you can able to rotate towards right as well as the left. That depends upon the individual, and also it causes forward flexion. So what is happening? Forward flexion. Again forward flexion, and as well as the rotation of the vertebrae based upon the individual. Okay, so if you want to move the mid thoracic or the lower thoracic, it depends. So but it is entire thoracic region, isn't it? So because such variations are due to the orientation of the facets, we can see. But common thing is the forward flexion, and also rotation is also taking place. It may be right side or left side. Okay, next I have considered in the next spinal segments, that is the third one, next spinal segment. One is upper lumbar L1 to L4, and lower lumbar L4 to L5, only L4 to L5, lower lumbar. And next one is the lumbosacral. So this lumbar region I have considered upper lumbar, lower lumbar, and lumbosacral. So what is the thing here? So what is the spinal motion? Again left lateral flexion. What is going to happen here? Here left lateral flexion causes rotation towards the right side here. So the body is going to rotate right side, as well as the forward flexion, right side and forward flexion of the vertebrae. Why? Because here again the orientation of facets are different. Okay, this causes rotation towards the right side of the body and causes forward flexion. Forward flexion is common for all the segments, but here the rotation is going to differ. So during manipulations of the vertebral column, you have to keep it in mind, all these coupled motion patterns. Okay, so in the next session we are going to discuss about the ligaments, and the simplest classification of the muscles which are associated with the entire vertebral column. Thank you.